Radiation therapy is an integral part of many different cancer treatments. Probably on the order of about 2/3 of all cancer patients receive radiation at some point in their treatment course. Radiation is a treatment that's often done either as the sole treatment for a particular type of cancer or as in combination with surgery and/or chemotherapy to treat and kill off cancer cells.
Radiation's been around for a while now, and the way that we practice it here, certainly we do our utmost to make sure that the process stays safe for the patient. It's been well studied, and everything that we do here has a lot of safety checks sort of built into it to make sure that the patient experience is as safe as it can be.
You have an initial consultation with us physicians to discuss what the treatment would look like and what the potential side effects would be. We go over in great detail so that you understand entirely what we're planning to do and what you can anticipate. The next step is typically what we call a simulation or planning session. So usually this takes the form of a CT scan.
Our simulation CT tech would help them get set up in sort of the same position that they would expect to be treated in for whichever location that they're receiving their treatment.
This whole scan process would only take about 20 to 30 minutes. And then you would go home and let us work on the plan for about a week or two on average, sometimes shorter than that.
That imaging gets sent to our dosimetrists who are working together with the physician to craft a treatment plan for that specific disease site. And once that process is done, it sort of goes and gets headed off to physics for us to do all our safety and quality checks on it. And eventually it sort of makes its way out and gets created at the machine. And that's when the therapists will be delivering the treatment to the patients.
You'll be brought back when the plan is ready to begin treatment. You're put on the treatment table exactly as you were put on the table at the CT scanning. The treatment machine itself is just a large arm that rotates around you. It's not enclosed. It's not like an MRI machine. Aside from seeing the machine rotate around you and hearing some buzzing noise from the machine, it's completely invisible. You don't actually see the radiation, and you don't typically feel anything when the radiation is given as well. It could be as few as a single treatment, or it could be several weeks of treatment. Given daily, Monday through Friday. On a typical daily treatment session, you may be in the treatment room for only about 15 minutes, maybe 20 minutes. And of that 15 to 20 minutes, only a minute or so is actual time with the radiation beam on. So we do a lot of steps to make sure that patients are lined up correctly, that we're treating exactly what we want to treat. Our nurses will be evaluating the patients and can field some questions or concerns that they may have. We physicians will be visiting with the patients at least once a week to address any side effects as they come up. Something like breast cancer, skin reaction is the most common side effect, and it often resembles like a sunburn type reaction. For other parts of the body, it depends upon what's receiving a significant dose of radiation. So if we're treating in the chest, you can get heartburn as if the esophagus gets a significant dose of radiation. If you're treating in the pelvis, you may have some effects on bowel movements, like loose stools, that sort of thing. The care that you'll receive here will be second to none. Here we're able to spend more time with patients to address their concerns. Patients get to be very familiar with our staff. There's a personalized attention that you don't typically get at a larger institution.
We're all doing our utmost to make sure the patient has a good experience here and leaves here both with their treatment done, but also peace of mind.
The bell is a symbolic conclusion to their radiation course. For many, it's a signal to celebrate getting through the radiation process, getting through cancer treatment, and then that they can now go on with the rest of their life.